FMT Guru. Today we are going to discuss FMT Practicals 2. In this session, we are going to discuss about examination of skeletal remains, difference between male and female skull, difference between male and female pelvis, and related important viva questions. Say yes or no, guys. Yes, Kushal Patil, good evening. Rakesh, good evening. Okay. Skeletal remains. One very commonly asked 5-mark question in forensic practicals. Okay. Like a bundle of bones given in the exam, a question can be asked, prepare the certificate of skeletal remains. The age, gender, cause of death, time since death, and other related facts. Yes. Now, here is the first question. The first question is, in crime scene. So we are in the crime scene today. Just imagine you are in the crime scene. 2 skulls are given there, A and B. Can anyone identify male and female? Identify the gender of the skull, A and B. So in A, steeper forehead is there. Frontonasal junction is prominent. Glabella is prominent in A. In B, the forehead is straight. Frontonasal junction is not prominent. Frontal eminence, parietal eminence is very prominent. V-shaped mandible, U-shaped mandible. Can you identify the gender, A and B? Shal Patil and others. So here, steeper forehead. Steeper forehead. Or we can say steeper frontal bone. Here it is straight. Point number 1. Glabella is prominent. Or glabella is angulated. Here not angulated. So 2 points only. There are many points. You can see U-shaped mandible also. U-shaped mandible, V-shaped mandible. Look at the eye. Orbits, they are square. Here they are somewhat red, somewhat round. Yes, can you try, guys, now? Very simple. Veda supervised telling A is male, B is female. Excellent answer. Kushal Patil, A is male, and good answer. Good. So many answered. So steeper forehead, muzzle markings are prominent, bony markings are prominent, glabella is prominent. The square orbit go in favor of male skull. If frontal eminence, parietal eminence is prominent, then it is female skull. This is one clue. U-shaped mandible, male. V-shaped mandible, that is female. So with this introduction, let's start the skeletal remains. Now, this is the proforma, the standard proforma of skeletal remains. You can see here this proforma, the format for examination of dismembered body parts are skeletal remains. This is the format. You need to write like this in the practical exam. Let's discuss one by one briefly along with the theory questions. The police sub-inspector. As you know, police sub-inspector is the investigating officer in most of the unnatural death. In case of 194 BNS, 194 BNSS, 194 BNSS is police inquest. Inquest means inquiry towards the cause of death, manner of death, or sometimes to identify the place of crime, time since death. So the inquest can be of different types: police inquest, magistrate inquest, and all. Police inquest 194 BNSS, magistrate inquest 196. So this can be 3 marks question in exam. The inquest means inquiry towards the cause of death. There are 2 types of inquest in India: police inquest 194, magistrate inquest 196. Please write in the chat box, police is equal to 194, magistrate is equal to 196. BNSS, Bharatiya Nagarika Suraksha Samhita. Keep writing along with me. So this can be a 3 marks question. Police station. So example, Bangalore Rural Police Station. Bangalore Rural, New Delhi Police Station, ITO Police Station, Shumaga Police Station. Okay, like that. So police station need to mention hypothetically, or if it is given in the the question. Okay, Veda Supava, very good, with great answer. Subject, what is the subject? Examination of skeletal remains or dismembered body parts. Reference, you can write the reference number, crime number, under section. It can be a case of murder 103 BNS, 64 BNS, that is rape, 66 BNS, rape and murder. Okay, so the Viva question can be asked, what is 66 BNS? 66 BNS is equal to rape and murder. Yes, Kushal Patel. You just write in the chat box, 66 BNS is equal to murder, rape and murder, like Delhi gang rape case. Yes, Bhumika, Anu, excellent. That's great. Now you can write the same line in the exam. With reference to above, received sealed article container, date, covering letter from the police sub-inspector, police station. The article was examined by me on particular date, particular time, particular place. So this is how you can write. So this carry half mark. The first point in the skeletal remains must be whether it is bone or not. Whether it is bone or not. Sometimes, synthetic materials, plastic material resemble like bone. It is confirmed with the help of histology of the bone. Like if you see Haversian canal, if you see osteocytes, then it is bone. So whether it is bone or not, you need histology section. Histology. In histology, if Haversian canals are there, Oakman's canals are there, then it is bone. If it is not there, it is probably plastic or synthetic material. Okay, this is the first important Viva question, and also question in your practicals as well. Okay. Then comes is number of bones. So number of bones, usually in exam it is 1 or 2 or sometimes bundle of bones in some universities. Dismembered body parts. Sometime in forensic medicine, the police people, they do come with the dismembered body part, like skull or upper limb, lower limb, or partial part of the body, dismembered body parts. Okay, yes, that you can mention one, usually one in exam. Physical state, whether are they dry, soft tissue present or absent, any signs of putrefaction, yes or no you can mention. belongs to human or animal? This is important question. How to identify species of the bone? Your answer must be Precipitin test. Human. How? Precipitin test. Precipitin test. Keep writing, guys. Whether human or not, the test is Precipitin test. So we usually use antigen antibody principle. So a particular antibody combines with a particular antigen, it forms the precipitation. If precipitation is there, then it is of human, when it is mixed with the human antiglobulins. If precipitation is not there, then probably it belongs to animal. Okay? Keep writing, guys, keep writing. Then comes is the next line, morphological examination. Very important. We call it as big four of identification. Big four of identification. Big four are, one is race, second one is gender, age, and the stature. Big four. Big four in snakes. Russell viper, saw-scaled viper, common cobra, common krait. Big four in identification. Race, sex, age, and the stature. A question asked in exam, how to estimate the race of the person? Can anyone answer? How to estimate the race? Now look at this here. So here is the skull. How to estimate the race? Mongolian, European, Asian, or Caucasians, Chinese. So how to identify the race? Anyone? Anyone can you tell me? So this is with the help of cephalic index. So try to memorize. The answer is cephalic index. Cephalic index can be 3 marks question. Cephalic index. Suhas, okay. Yeah. Race with the help of cephalic index. What is cephalic index? Cephalic index means maximum breadth of the skull, maximum length of the skull, multiplied by 100. Based on that, it is classified into dolichocephaly, mesenterophy, brachycephaly. Dolicho means 70, 75. 76 to 80, that is mesenterophy. More than 80, brachycephaly. Dolichocephaly usually Africans, Aryans, mesenterophy Indians, brachycephaly Mongolians. Okay? Yes, Indians. A typical Indian skull comes under the mesenterophy. It is 75 to 80. Again, the values are not that accurate. So other values are there: crural index, humeral index, and all. Okay, intermembral index, nasal index, and all. One commonly asked question is cephalic index. So keep answering. Now look at this. So this is, can anyone identify what is this instrument? You must have seen this instrument in the forensic lab. So this is how we measure maximum length of the skull. So here is the maximum length. So that is between the glabella to occiput, maximum length. So this instrument is spreading calipers. Spreading calipers. Yeah, next. This is maximum breadth of the skull. . between two parietal eminences. I hope it is clear, guys. Is it clear? Race, is it clear? Say yes or no. Race. Yes, Anu, Suhas, Bhumika Reddy, Veda Supava, Rakesh. Is it clear, guys? The sex with the help of Krogman formula. Krogman formula. With the help of bones, like pelvis is the best bone, around 95% accuracy. Skull around 90% accuracy. The skull and pelvis around 97%. Long bones 80%. If entire skeleton is given, the accuracy is 100%. So this can be viva question. The best bone is pelvis. Okay. Then comes is the age. So age with the help of, basically with the help of dentition. Look at the appearance of the teeth, usually in living person. Or Gustafsson method. Or sometime ossification centers. Skull sutures. Skull sutures. Okay. Good. So age can be estimated with the help of ossification center, that is X-ray. Skull sutures, not accurate method, but it is commonly asked in viva. Gustafsson method, it has 6 components, very important theory question. And dentition. Okay. Now stature, the stature with the help of length of the long bone. Length of the long bones, like example femur length, length of the humerus, length of the radius, length of the ulna and all. So all these are big 4 of identification: race, gender, age and stature. So this is the 5th point in the skeletal remains. The 6th point basically belongs to one or more individual with the help of DNA, fingerprint, articulation, with other criteria. Okay. Injuries are manner of separation, again sometime gunshot wound. Outer table beveling is there in exit wound, inner table beveling is there in the entry wound. Cause of death up to some extent, if it is a gunshot injury or some other fractures are there. Time since death, again it is not very easy. It is based on the nitrogen content, based on the osteocytes and all. So the 9th point is time since death, or else you can write in the answer sheet not applicable. It is not possible with the bones, without the microscopy and without the advanced techniques. Opinion, yes, opinion you can write male or female, and the probable race, probable age and probable height of the person. Okay. Date and time, then signature of the doctor, office seal. So this is how you are going to write your format for examination of dismembered body parts as skeletal remains. I'll repeat, there are basically 9 points are there. The point number 1, that is the whether it is bone or not. Point number 2, number of bones. Point number 3, physical state of bones, belongs to human or animal. Point number 5, morphological examination, which is the heart of the certificate, belongs to one or more individual. Injuries are manner of separation, cause of death and time since death. Okay. Yes. Is it clear, guys? Is it clear? Say yes or no. Now some points about differences between male and female skull. Let me explain with this basically. You can see here. So this is the male skull. Are you there, guys? Look at this. Yes, can you able to see the skull now? So look at the skull. Say hi to our Boni, a male Boni here. Boni, say hi to Boni. Yes, Supava, Vera Supava, Anu, Bhumika. Just say hi to our friend, Boni. Just say hi. Now look at this male skull. It is larger and longer. So size is larger and longer. The capacity is around 1500 ml. So big one, a big man, 1500 ml. So good. Then look at the architecture. So architecture is totally rough. The feeling is there, no? It is a ragged look, ragged. So muzzle ridges are marked, occipital temporal area. So like this, there are many points are there in exam. So try to memorize one by one. And look at the forehead now. So this is the forehead. So the forehead is steeper forehead. Can you make out, guys? Steeper forehead here. Steeper forehead. Straight forward in case of female. Glabella. So this is glabella. So glabella is prominent. So this is the frontonasal junction. So the glabella is prominent in male. Females it is not prominent. Frontonasal junction is prominent. Orbits. Look at the orbits. Orbits are square. Look at that. Orbits are square. Supraorbital ridges. Supraorbital ridges are prominent. So this is the supraorbital ridge. You can see here supraorbital ridge, which is very prominent in males. Cheekbones are heavier. So cheekbones. So this is a zygomatic bone. Okay, this is the cheekbone. There is a cheekbone here. The cheekbones are basically laterally arched. Laterally arched. Zygomatic arch prominent. So this is the zygomatic arch. Very prominent in males. Less prominent in females. So 10 points. Then comes his nasal aperture. Nasal aperture is higher and narrower. External auditory meatus. Yes, look at this. This is the external auditory meatus. So bony ridge along the upper border is prominent. So you can see here the bony ridge is there and the upper border which is prominent here. So can you make out? Can you make out this point? Can you make out this point, guys? Yes or no? Where is Upava? Anu? Are you there? Bony ridge along the upper border of the external auditory meatus is prominent. Yes or no? Yes or no, guys? Yes, it is prominent. Frontal eminence is small. So this is the frontal eminence which is very small in males. In females it is large, very prominent. So all are prominent except frontal eminence and parietal eminence in males. Frontal eminence is small. Parietal eminence is also small, not very prominent. Frontal sinuses are much developed. Occipital area, look at the occipital area now. So Bhumika, occipital area. So this is the occiput. This occiput is basically muscle lines and more prominent protuberance. So this is the protuberance. This is very prominent in males, less prominent in case of females. Very prominent. Nuchal lines are very prominent. Mastoid process. Look at the mastoid process. You can see here. This is the mastoid process. You can make out here. Make out this is the mastoid process. Don't mistake me. This is actually a firearm. Look at this. The tip of the firearm. You can see this. This is the mastoid process. The mastoid process is wider, longer, round and blunt. In females it is narrow, short, smooth and pointed. Then base is again insertions are very prominent. Digastric groove is prominent. Then comes is the condylar facet. So condylar facet. Look at this now. So this is the condylar facet, which is long and slender. You can see here, long and slender. Occipital condyles, they are basically large. The palate is U-shaped. You can make out. Palate is U-shaped. Foramina is larger. So this, look at this, foramina is large, very large. Foramina magnum is also large. Teeth are large. Again, teeth are not there here anyway. So all these are 25 points. The difference between male and female skull, in case and read the textbook of forensic medicine, 25 points are mentioned. So there are 25 points. Yes, I hope you understood, guys. I hope you understood difference between male and female skull. Yes, Vera Supava, Bhumika Reddy, Anu, are you there? So my favorite point is steeper forehead, square orbit, supraorbital margins are very prominent. Yes. Now question is difference between mandible, so male and female mandible. So you can go through this table, and very simple actually. Male and so male, it is larger and thicker, square shaped chin. So body height is at symphysis is greater, ascending ramus is greater breadth, angle of body less obtuse, condyles larger, mental tubercle large and prominent. Good, that's okay. Now आगे देखते हैं one more. Now mandible, you can read pelvis now. Now look at the pelvis. What are the features of the female pelvis and male pelvis? Look at this. This is the male pelvis. Okay, male pelvis. Say hi to our pelvi. Just write pelvi. Hi pelvi. Hi, how are you? Just say pelvi. Let's discuss important points about male pelvis and differences between male and female pelvis. Okay, just write hi pelvi. Come on, guys. Come on. Okay, so one by one. Again, the bony framework of male pelvis, I'll just hold like this. Okay, massive. So in males it is massive. It's very heavy actually, very heavy. Anyway, it needs some comparison. So yes. Then the deep funnel like. Look at the ilium. So ilium is less vertical. It is less vertical. The iliac crest reaches higher level and is prominent. A very important point is preauricular sulcus. The preauricular sulcus is not prominent. So this is the area of preauricular sulcus. Normally this is the area where preauricular sulcus, which is very prominent in female pelvis, not in male pelvis. And look at the greater sciatic notch. This is very important. Concentrate. So this is the greater sciatic notch. You can make out here. Greater sciatic notch. The greater sciatic notch is narrow and deeper. So this is very important point. Please write in the chat box. The greater sciatic notch is narrow and deep in males. Narrow and deep in males. Keep right, narrow and deep in males. This is very important MCQ as well. The best feature of female pelvis. Before puberty, your answer must be greater sciatic notch. Greater sciatic notch is wider and shallower in female, narrow and deep in case of male. Very important. Then ischial tuberosity, that is inverted. So there are many points are there. Body of pubis, ramus of pubis, ischiopubic rami, symphysis, subpubic angle, pelvic brim, pelvic cavity. So this we can go through after the class. So differences, anyway, I'm going to provide the PDF. Now this image, look at this image, A and B. Can anyone make out male and female pelvic bone here? This is A and this is B. So look at this. This is somewhat shallow and wide. Here it is somewhat narrow and deep. तो देख के बताओ मेल कौन सा है, फीमेल कौन सा है. Keep answering this. So this is basically female and this is of male. I said already. Okay. You can make out once again here. So this is male because it has deep nature and it is narrow. It is not wide. Okay. Then this is also a very important point. Okay. Chalo. Then sacrum, you can just go through difference between male and female sacrum. And male and female femur. Radius scapula not very commonly asked. Sometimes question can be asked about sternal index also. Then carpobasal index and the sacrum. So this completes today's session, guys. This session is over. That is especially pro forma of skeletal remains. If you have any doubt, you can ask me for next 5-10 minutes. So this is you need to write in the exam. Any doubt? So Bhumika, Supava, are you there? Any doubt in the basically difference that is examination of dismembered body parts and skeletal remains? Rest all you can just go through difference between male and female skull, pelvis, sacrum, femur and all. That's more of a theory basically. A commonly given bone is skull. Sometimes it is pelvis. Yes, theory sessions are already over. Now I have one more important session today, that is MCCD. How to write MCCD? That is also commonly asked question. MCCD. Fine. Medical certificate of cause of death. 5 marks question again. Now concentrate. MCCD. What is MCCD? MCCD means medical certificate of cause of death. Medical certificate of cause of death. In this you need to write name of the hospital like AIMS Delhi, MMC New Delhi. Then you can write all the details, male, female and all. The cause of death in MCCD has 2 parts, part 1 and part 2. You can see here part 1 and part 2. Part 1 again 1A, 1B, 1C, 1A, 1B and 1C. 1C leads to 1B, 1B leads to 1A. Okay, 1C leads to 1B, 1B leads to 1A. And also you can mention interval between onset and death. Like example here, a case of breast cancer. Case of breast cancer. Advanced breast cancer. Metastasis to the brain very common. As you know, metastasis very common. Breast cancer leads to a metastasis. The metastasis leads to cerebral hemorrhage. Cerebral hemorrhage. That means 1C leads to 1B, 1B leads to 1A. So this is how you can write in the exam. That means 1A means immediate cause of death, 1B antecedent cause, 1C main underlying cause. So 1C, 1B and 1A. Again you can mention breast cancer since 5 years, metastasis since 1 year, cerebral hemorrhage since 5 days, and diabetes and all you can write here. Diabetes, hypertension and all we can mention in the part 2. So part 1 immediate cause of death. The part 2, other significant condition contributing to death but not related to directly into the immediate cause of death. Contributory condition comes under part 2. Okay. Yes, Rakesh. Rakesh, you understood? Okay. Now look at this. Can anyone tell me? Anyone? Yes, this condition. One more example you can, let's discuss one more example. COVID-19 leads to acute respiratory distress. ARDS. ARDS leads to respiratory acidosis. COVID-19 since 7 days. ARDS since 3 days. Respiratory acidosis 2 days. So this is 1A. This is 1B. This is 1C. One more example. One more example. Good example. Let's see. Look at this. This is a good example again. One more very good example. You can write in the exam as well. Chronic ischemic heart disease. Heart disease. Since 8 years. That is the 1C. Leads to acute myocardial infarction since 7 days. That is 1B. Leads to pulmonary embolism, that is 1A. And non-insulin dependent diabetes mellitus, obesity, hypertension and all, they are basically contributory. So this is how a question can be framed in exam. Okay, now one more question asked in the exam. Which of the following is known as essence of death certificate? Anyone? Anyone can you answer? Which is known as essence of death certificate? Essence of death certificate, heart of the death certificate. Options are 1A, 1B, 1C and 2. Rakesh, Vedasupava, Bhumika, Anu. So the answer is 1C. The 1C is known as essence. Fine. So this completes MCCD as well, a simple exercise. I hope it is clear, and also you need to mention about the manner. Natural, accident, suicide, homicide, pending investigation. If disease was a female, was pregnancy, the death associated, you can write mention yes or no. So this is MCCD. 5 marks question. Okay guys. Thank you all. We will come up with some more exercises tomorrow, especially examination of victim of rape, examination of accused of rape, and few postmortem certificates. Thank you.